Let me ask you something most doctors never bring up at your annual checkup. If you are a man over 50, are you actively maintaining your sexual health? Not just waiting to see if problems show up, actually deliberately maintaining it. Because here's what I have noticed after years of studying men's health content and research. There is an enormous gap between what modern science knows and what men over 50 are actually told. Doctors have 12 minutes with you. Cultural stigma fills the rest of the silence with myths, guilt, and outdated locker room wisdom. Today, I want to close that gap. We are going to talk about something rarely discussed openly: the clinical science behind male sexual self-care after 50, 60, and 70. By the end of this video, you will have a practical, science-backed framework that could genuinely protect your prostate, your cardiovascular system, your sleep, and your long-term vitality. Stay with me, because the research we cover in the middle of this video genuinely surprised me the first time I encountered it. First, let's dismantle the foundational myth. Many men were raised with a deeply embedded belief that sexual self-pleasure is somehow draining, that it weakens you, depletes your energy, diminishes your masculinity. This belief shows up across cultures, religions, and generations. And while I respect that personal values shape individual choices, from a purely biological standpoint, modern medicine tells a completely different story. Here is the key distinction that most health content misses. Context matters enormously. A behavior that is harmful in excess or in isolation can be genuinely therapeutic when practiced with intention and moderation. We see this with exercise. Running is healthy, but overtraining destroys your joints. We see it with sunlight, necessary for vitamin D, dangerous in excess. Sexual activity follows the same biological logic. With that framework in mind, let's look at what the research actually shows. Benefit 1. Prostate flushing. This is the one that genuinely shifts perspectives. A landmark study out of Harvard University, one of the most cited in men's urological health, found that men who ejaculated approximately 21 times per month had a 33% lower risk of developing prostate cancer compared to men who ejaculated 4 to 7 times monthly. Now, here is what most summaries of this study leave out. Why this happens matters just as much as that it happens. The prostate gland produces seminal fluid. When that fluid sits stagnant in the ductal system for extended periods, it creates an environment where inflammatory cytokines and potentially carcinogenic compounds can accumulate. Regular ejaculation physically clears those ducts. Think of it like flushing a pipe that would otherwise calcify. This is not about frequency for its own sake. It is about maintaining a biological system that, less stagnant, becomes a risk factor. Here is a clinical reality almost no one discusses with older men. The erectile tissue, specifically the corpora cavernosa, requires regular oxygenated blood flow to remain elastic. Without it, a process called fibrosis can gradually harden and shrink that tissue. My personal analysis here: this is essentially the same principle behind physical therapy for any muscle or tissue group. Disuse leads to atrophy. Deliberate, regular use maintains function. The men I have read about who maintain the healthiest erectile function into their 70s are not necessarily the ones on medications. They are the ones who never stop treating their bodies as systems that require active maintenance. Benefit 3. Pelvic floor strength. The pelvic floor is one of the most neglected muscle groups in men's health conversations. Yet it is directly responsible for erectile rigidity, ejaculatory control, and urinary continence. The involuntary contractions during orgasm are, clinically speaking, a form of resistance training for the pubococcygeus and surrounding musculature. My addition here: most men only discover their pelvic floor after a prostate surgery or incontinence diagnosis. At that point, they are doing Kegel exercises to recover function. The smarter approach, backed by basic exercise science, is to maintain that function before it deteriorates. Prevention over rehabilitation, always. Benefit 4. Cortisol reduction and cardiovascular impact. Orgasm triggers a measurable, immediate drop in cortisol, the body's primary stress hormone. Chronically elevated cortisol is associated with hypertension, arterial inflammation, immune suppression, and accelerated cellular aging. For men over 50, who statistically carry higher baseline cortisol levels due to accumulated life stress, this hormonal reset has real cardiovascular implications. This is not a minor point dressed up in dramatic language. Chronic stress is a genuine killer for aging men. Any reliable, repeatable mechanism that safely lowers cortisol has clinical value. Benefit 5. Sleep architecture. Post-orgasm neurochemistry is remarkably elegant. Oxytocin rises, prolactin surges, a hormone strongly associated with sleep onset and depth. Cortisol falls. This is not a coincidence. It is a biological sequence evolved to promote recovery. For older men suffering from fragmented sleep or chronic insomnia, this hormonal cascade is genuinely significant. My commentary: the sleep medicine field has increasingly connected poor sleep in men over 60 with testosterone decline, cognitive deterioration, and cardiovascular risk. Anything that reliably promotes deep, restorative sleep deserves serious attention. Now, here is where I think most health content does men a disservice. It either ignores the risks entirely or exaggerates them into moral warnings. Let's be clinically precise instead. Risk 1. Skin vulnerability. This is the most physically immediate risk for older men, and it is consistently underestimated. After 50, collagen production drops significantly. Skin becomes thinner, less elastic, and far more prone to microscopic tears from friction. Those micro tears are not just uncomfortable, they are entry points for bacterial infection and inflammation. The solution is simple and non-negotiable: high-quality, water-based lubrication. Treat this the same way you would treat any physical activity that creates friction on aging tissue. You would not run a marathon in shoes that don't fit. Same logic applies here. Risk 2. Neurological adaptation. This one has deep implications that extend far beyond the obvious. When the brain receives the exact same stimulus in the exact same way repeatedly, it adapts. It becomes less responsive to that specific pattern. This is basic neuroscience: habituation. What makes this clinically significant for older men is that this desensitization can transfer, meaning the neural pathways associated with partner intimacy become harder to activate. My analysis: this is not a moral argument, it is a neuroscience argument. Variety in sensory input maintains neuroplasticity. This is true for cognitive health generally. Novel experiences, new skills, changed routines all preserve brain flexibility. Sexual neurology follows the same rules. Risk 3. Masking underlying pathology. This is the risk I consider most medically serious, and it is the least discussed. A man who can perform reliably alone, but consistently loses erection with a partner, often attributes this to anxiety or age. But clinically, this pattern can signal vascular insufficiency, early-stage diabetes, or significantly reduced testosterone. These are not minor issues. They are systemic health warnings wearing a specific costume. The point is not to alarm. It is to encourage men to use this information diagnostically. Your sexual function is a window into your vascular and endocrine health. Changes in that function deserve medical attention, not silent acceptance. Risk 4. Psychological dependency. When any behavior becomes the primary coping mechanism for stress, grief, loneliness, or anxiety, it stops being a tool and becomes a dependency. This matters regardless of what the behavior is. The clinical fix is not abstinence. It is diversification of your dopamine sources. Exercise, social connection, creative engagement, meditation. Sexual self-care should complement a rich life, not compensate for an impoverished one. Risk 5. Pornography and dopamine burnout. Modern high-stimulation internet pornography operates on the same neurological mechanism as any superstimulus. It floods dopamine receptors with levels of arousal signal that real-life intimacy simply cannot match. Over time, this creates a calibration problem. The brain's reward threshold shifts upward. Subtle, genuine human connection starts to feel muted by comparison. This is not a cultural or moral observation. This is receptor-level neuroscience. Protecting your dopamine system is as legitimate a health concern as protecting your cardiovascular system. So, where does all of this leave us practically? Think of your sexual health the way you think about your physical fitness. You would not skip all exercise and expect your heart to stay strong. You would not exercise compulsively and expect your joints to recover. You aim for consistency, variety, and recovery. Applied to this context, that means maintain regularity, not obsessively, but consistently. Once or twice a week appears to be a reasonable general range supported by the research, though individual physiology varies. Protect aging tissue. Lubrication is non-negotiable for men over 50. Full stop. Vary the experience. Preserve neural sensitivity by avoiding rigid, repetitive patterns. Monitor your function. Treat changes in sexual function as health data, not just inconveniences to manage privately. Protect your dopamine system. Limit high-stimulation pornography, and actively engage your imagination and physical sensation instead. Never use it to replace human connection. The warmth, complexity, and neurological richness of genuine intimacy cannot be substituted. Use solo practice to maintain your capacity for connection, not to avoid it. Here is the broader truth underneath all of this science. The men who age with the greatest vitality, physically, cognitively, sexually, are not the ones who surrender their bodies to the passage of time. They are the ones who keep showing up as active participants in their own health. They ask the questions that feel uncomfortable. They replace inherited myths with updated information. They treat their bodies with the same intelligence and intention they would bring to any other important system in their lives. Your body at 60 or 70 is not a diminished version of your body at 30. It is a different chapter, one that responds extraordinarily well to informed, deliberate care. The science is clear. The path forward is practical. And honestly, this conversation, the one you just had with yourself watching this, is already a step most men never take. Take care of yourself. You have earned the right to do it well.